So today I'm with Amy and Jason to answer some of the questions that have been submitted. So let's get started. Amy, since I hit menopause, my sleep has really deteriorated. What's the best solution?
So it really depends on what the problem is, so what's causing it. So as we experience the menopause, we might have a change in weight, we might increase our snoring threshold, and as a result of this, we might actually be experiencing sleep apnea, which can cause excessive daytime sleepiness or tiredness, or just overall dissatisfaction with our sleep quality. We also experience changes to our mental state, so anxiety, depression, and also a change in our sleep hormone, which may actually be increasing our insomnia. And also another point to mention is actually our changes in temperature, so spikes in our temperature, which we refer to as hot flushes, and whether or not they're sort of causing sleep arousals as well as it could be a contributor.
So I think that there are so many various different things going on throughout menopause. It's really trying to find out what they are and finding the solutions rather than there being one solution. Thank you. Will sleeping tablets, melatonin or sleep remedies help me, and are there any dangers?
So we prefer natural remedies. So natural remedies and lifestyle factors tend to have a hugely positive impact on sleep when used correctly and when used as a combined sort of approach. Medications are available and often have to be prescribed through our GP, and they're often given in a short-term sort of dosage. And the reason for this is because they can become quite reliable, so we end up almost believing we need these medications to encourage sleep, whereas having them on a short-term period allows us to have that sort of almost placebo effect, which can often actually reverse insomnia or insomnia-like symptoms. So it depends, and it's again person by person approach.
And what are some of the more natural remedies that you say you can use alongside lifestyle?
So things as simple as, chamomile tea before bed can make a huge change. Melatonin also. So melatonin is a sleep hormone that's produced within our body, but again that should be used correctly and safely, and so asking a professional for help in how to balance that within the life can really be of proper importance.
Okay, all right then. Jason, how effective / accurate are sleep trackers on my phone?
Well, if you're a normal sleeper and you don't get anxious about your sleep, they can be used quite effectively. They're quite accurate, actually, in terms of sleep duration. So how long you're actually getting per night. The challenge comes when we start to look at sleep disorders. They're not terribly accurate for people with sleep disorders, but also, a lot of them telling us information about what stages of sleep. Well, I can tell you that is not terribly accurate. Right. We tend to have to use an awful lot of electrodes in our laboratories to work it out, so we're not really going to get it from our watches.
Okay, so it can give you a reasonably accurate length of time you're asleep, but not perhaps much more than that.
Not really.
Okay. Does lack of sleep put me at higher risk of dementia?
Great question. There is an association between short sleep durations for a long period of time and disrupted sleep and dementia. We think this is because during slow wave sleep, that deep sleep that we get, we're clearing out the brain and we're clearing out particular toxins, beta amyloid, which is largely associated with dementia. Now that's great in the sense that it gives us an opportunity as well, because if we can start to manage sleep, are we going to start to manage people getting dementia, or at least the pathway?
And I think, many people are very scared of getting dementia. So I think, this information, it's not there to scare us. Actually, it should empower us to think we can all make tweaks at least to improve the quality of our sleep. And I think that's quite a motivating factor potentially for people.
Absolutely.
Amy, are there some sleeping positions that are better than others?
Simply put, no. So it's quite a common question. How can I improve my sleep? If I sleep on my side, if I sleep on my back, it comes down to each individual. So obviously if we experience back pain or shoulder pain, we might find a position comfortable and another position not comfortable. The only time that it sort of really comes into importance is when we have supine dependent disorders. So particularly our sleep apnea, where lying on the back actually increases the number of events that we're having. So how many times we're having those stoppages of breathing. In those cases, we would try and train the body to sleep in a non-supine position.
So that's not on the back?
Not on the back,
but
again, it can be on the front. It really comes down to preference, and throughout life, our sleep position may change as our body changes also. So yeah, so not necessarily a perfect position for sleep.
And I once heard a tip, I think it was from you, Jason, many years ago, that you can strap a tennis ball onto the centre of your back so that if you roll over onto your back during sleep, you'll automatically shift back onto your side or your front.
Yep.
Does that work?
It does. Thankfully, due to technology improvements, we actually have what is now just a band that sits around the waist.
Designed for that. I mean, it
so
was years
it's
ago.
much less intrusive and uncomfortable, but yes, it would be a really good...
I'm old school.
It would be a very good way of preventing that supine sleep for sure.
Okay. Jason, this is one for you, and you can tell us why. Why do my legs twitch in my sleep?
So what tends to happen is that some people have got a problem whereby they actually have slight twitching in their legs at night, and it's called periodic limb movement disorder. And I happen to be one of those people who suffers from it. Now, I don't actually remember these events, and many people who have them don't remember them, but it does lead you to feel a lot more fatigued and tired during the day because you've had slight awakenings during the night. We tend to separate this out from something called restless leg syndrome, which is more as you're getting ready for bed. Itchy, crawly, uncomfortable sensations in the legs which prevent you from getting off to sleep at night. But they are quite joined. Now, there are things we can do. We can go and see our GP, talk to the GP about medication or other options.
Okay, all right. And what's interesting, I think, and a reminder for everybody, is that you can be a professor of sleep and actually we're still affected by these things, aren't we? As humans, we can still be affected.
You can still also go unnoticed despite your plethora of sleep knowledge. These things can go without being caught until sort of, our symptoms take over and suggest that there is actually a sleep disorder there.
Yeah, and I guess, and yours was only picked up because you volunteered to test out some new equipment. You were the guinea pig.
Exactly. I decided to try out the new equipment myself, and then my technician comes and says, "Oh, look at this," and I think, well, that's terrible. And then she tells me it's me, so it's okay. I'll have to do something about it.
The next question, for people who work shifts, I have a lot of experience of that, what can they do to minimise any issues relating to poor sleep?
Of course, shift work is not great for us, and the things that we can do to help minimise it focus really about our relationship with light, dark, and valuing the time that we sleep. Before the end of a night shift, it's best to try to cool down with light. Not get too much access to light. You'll start to wind the body down getting ready. When you do get home, don't fall asleep on the sofa. Go to bed. The sofa is a daytime zone. You're going to have people outside. You're going to have noises. The washing machine might be going. And let people know that you are actually on a night shift. Equally, if you're getting ready for a night shift, getting access to light before the night shift is going to give you that extra alertness to get through.
All right, really great tips there. And finally, a very, very, very common problem I hear about is how can I stop snoring? Or actually, often it's how can I get my partner to stop snoring? I think if we add the answer to that, it would be very rich.
Yeah, it's an interesting one. Snoring, there are a couple of things that make snoring worse. So if you've had alcohol, for example, or we use some sleep medications, they tend to relax the throat and therefore it's more liable to closing ever so slightly. If there is snoring, it's not to be taken as a trivial thing. I know in society we tend to do so, but actually it's important to go and check to see whether it is something more severe, obstructive sleep apnea, which would need treatment. And there are plenty of treatments available.
It's often the person who's not snoring that is the one whose health can suffer, isn't it? Because there's always then having different beds as well, having
the sleep divorce,
to prevent a real divorce.
Yeah, it can make a huge difference, and it can increase, lots of other things within life which then enhance the relationship. So it's not to be feared.
Yeah. Okay. Well, Amy, Jason, thank you so much for that. And I really hope that there were some takeaways there that will help you. I think the bottom line being, we can all make some changes to improve our sleep. So feel empowered, not afraid.